So let's go into some of these treatment options. To reduce the stress and strain on the front of the foot, we use orthotics to help with posture and alignment, and there are different modifications where you can take the pressure right where it hurts. Now, the key to an orthotic is to have it contour very nicely to your arch. And that's really the key. That's the main difference between this and something that you can get over the counter that doesn't contour as much. The more you contour, the more it takes the pressure off the ball of the foot. There are other types of modifications you can use as well with your orthotic. I do a lot of shockwave for pain to the front of the foot. This is a treatment modality where it uses a bullet that goes back and forth, hits this piece of metal, causes these radial shock waves. This is an example on the heel. I usually do it to the ball of the foot. And I do this for painful metatarsals that aren't a stress fracture. And what it does is it helps with healing. And this works very well. Basically what it does is it injures the tissue, because a lot of times these become chronic areas of inflammation. And if you remember from the pictures before, they're colored white. And I think it's so important. I'm actually going to go back and I want to show you some of this in terms of the anatomy. If you look at the anatomy here, this is all white and this is all white. And you see this red right here? That's muscle. So muscle has good blood supply. All this white stuff doesn't have the best blood supply. And most of the treatment for these areas that are white tend to be challenging, such as plantar fasciitis, Achilles tendonitis, things like that, because there's not the best blood supply. So what this treatment does is it actually injures the area to increase new blood flow to that area. So this is a very beneficial treatment for this. We do use some injections in certain areas around tendons, around nerves. This is the amniotic injections that we do in the office. Those can be used if you have an area of inflammation and you don't want to do a cortisone injection. Certainly the standard, a lot of patients, they use anti-inflammatories. I don't like to use it more than 2 weeks. If it doesn't help, you probably need something. And it's not just a new shoe. If you've tried 10 shoes, it's not just another shoe that'll cause a solution. A lot of my patients as well, they do well with icing and contrast baths. A real key is to do contrast baths. So it's 5 minutes in ice, 5 minutes in hot water, then back in 5 minutes in ice water. That can be helpful. Once again, if you've done that for a couple of weeks, it's not getting better, you should probably see someone, but icing is important. Reducing the calf, the tighter your calf is, the greater forefoot pressure you have. So loosening the calf can be important. A lot of patients that do a lot of walking, they get pain to the front of the foot, and loosening the calves can really help reduce that load. There's a modality called Graston technique that the physical therapists do. We send people out for that, even though the bottom of the foot hurts, I know, but we still work the back of the calf and everything else. Here are some home tools that you could use, different trigger point balls, foam rollers, things like that. And then there are a lot of pads. For example, if you have a hammer toe that sticks up that's causing this ball of foot pain, you can use one of these pads called a Boudin splint. There are different types of pads called crest pads that go under. There's these metatarsal pads that go in the shoe. There's ones that stick on your feet. There's tons of different things that you can get. Once again, if you spent more than $100, go see a doctor. It's probably just going to be a lot easier to get treatment. And then for a lot of my patients, if they have a stress fracture or something, I'll put them into a walking boot or something like that. Okay. So those are kind of some of the treatment options. I like shoes. Different types of shoes can be helpful. The easiest thing to change, guys, is changing your shoes. Okay. Hoka's, Topos, Asics, New Balance, something like that. Don't go cheap on the shoes, please. Don't go cheap on the shoes. You want to get something that's good.